Well, I want to say hi to everybody. We're here with Jasmine. Jasmine flew in yesterday from Missouri to be treated for her CRPS condition, as well as some dental work that she's going to need that relates back to her CRPS condition. She has full body CRPS secondary to trauma sustained quite a few years ago. The flight out here was quite stressful, and when she presented to the office yesterday, she was in quite a bit of pain. So we went ahead and delivered all the blocks you'll see me doing today. We actually did yesterday, and I'm going to let Jasmine describe for you the symptoms she had before the blocks and what relief she got from them. So Jasmine, we're going to be repeating them today for a reason which I'll explain to you. Jazz, you go ahead.
I had burning, electric, fiery pain from head to toe. I was having vision problems, and I had no quality of life. After the blocks yesterday, the pain in my eyes and face went away. My vision, I could see perfectly. My neck started to loosen up, and I had no pain in my hands. And that's the first time I've had no pain. And who knows how long I remember.
Did you get relief down your back too at all?
Yes, to my middle back.
Okay, so these blocks work. What we're blocking are the sympathetic innervation that comes out of the upper cervical spine. You'll see I'm not injecting into the spine or anywhere near it. These are peripheral nerve blocks, but I'm blocking specific sympathetic nerves. And what's interesting is that there's a trickle down from blocking these nerves. And you heard her say she got relief literally from the head down to mid-torso from injections to the neck and skull area. So that's the good news. She got profound relief when she had been in terrible pain for many, many years. The downside was when the blocks wore off, she did ramp back up to a full level of pre-injection pain. Now, she's had this for so long that I was surprised that she got the relief she got, and not surprised that it came back with the vengeance that it did. And that's okay, because the treatment here is to block her again. We have certain medications on board that we can talk about another time. These are not narcotics. I do not use narcotics. I use medicines that regulate nerve function. One of them is Lyrica, anti-inflammatories. That's ibuprofen. And a new pain management medication, it's non-narcotic, non-NSAID, called Pluripain. And in combination with the blocks, I'm hoping we'll tamp this down. We got a tremendous response. The goal is to sustain it. There is no cure for CRPS. We all know that, but there is sustained abatement, and that's what we're going for. So hopefully today, when these blocks go on board, that we'll get sustained relief beyond the length of the anesthetic. And then every day, we're going to be repeating this and documenting to see just how far out we can get this. And in conjunction with that, we're looking for triggers, because Jasmine does have some trauma that she sustained to the head and neck area, and we have to look at cervical spine and her jaw joints, and we'll be doing a chemical analysis based on where she lives, and that there's a potential for some chemical toxicity as well. So the three things I always look at is upper cervical spine, the TMJs. We do that via MRI. She's having that done in a couple of days. We'll come back and discuss it, and a chemical analysis will be done. So we're going to go ahead and set her up now to do the block. We're ready to go. And again, I use just plain local anesthetic. That's all I'm using. There's nothing magic about this. It's just a local anesthetic. The sensory nerves will go numb, and she's going to get a sensation of being numb to her skin. And that's how I know I got a good block, because the sensory nerves and the sympathetic nerves I'm going after are side by side. I'm not numbing the sympathetic nerves. I'm blocking their ability to transmit the dysfunctional sensation that CRPS patients have. Okay, so first thing we're going to do is just disinfect her neck a little bit. So I'm going to lean you back, okay? Put your head back for me. And this is an injection. It pinches a little bit, and Jasmine might respond, and that's okay. So we're just disinfecting the area of injection. So I'll be injecting on the side of her neck. This is right around the sternocleidomastoid muscle. That's that big neck-turning muscle. And this is a subcutaneous injection. It's under the skin and over the muscle. That's where this branch of this nerve is sitting, and that's what we're going after. Okay, so here we go, Jazz. Okay, so her head's turned all the way towards me. That lets me outline the muscle a bit, and I can sort of see it already. And I just draw a line right across the angle of her jaw, across the muscle. I'm just sort of outlining it with my fingers. So you press against my hand a little bit, please. Then when she pushes her head against my hand, it pops the muscle up a little bit, and I get a better outline. Okay, so we're going to come in now, going under the skin and over the muscle. That's where we're aiming for. Okay, it pinches a little bit. You all right?
Mm-hmm.
All right. It's a very slow injection. And as I'm injecting over this muscle, I'm just drawing the needle back slowly because that nerve is sitting somewhere over that muscle area. Are you feeling anything, Jazz? Any pain from the shot? No? Good. Okay. We're almost done. Okay. That's the first one in. And then we just like to just wipe the area down again. See, if you can see, there's just a bolus of anesthetic under the skin and over the muscle of the SCM muscle, the sternocleidomastoid muscle. That's the greater auricular nerve block. It's one of the branches of the superficial cervical plexus, which is loaded with sympathetic nerves. That could be part of what's lighting her up. Again, yesterday she responded so well to these blocks. The goal is to sustain the effect that we got, and that's going to be through repeating these blocks, the medication, and we also have a massage therapy chair. That also is a great help to her. It does a massage while you're sitting in it because the massage creates circulation, and that's what we want. Head straight, and I'll let you rest. All right, so we're going to keep the clock running and keep the camera running, and we'll let Jasmine tell us, because she's in pain, and she charted out her pain, and as this first one kicks in, we'll let her describe what's happening, okay? So you let me know when you start to feel like your ear may be starting to get numb a little bit, or the side of your jaw. Okay, that's the beginnings of the block taking effect. Okay. Now I'm going to set up for the next one. Also, each time we do a different injection, we always use a fresh needle. It's the same person. It's not for contamination. It's because the needle blunts a little bit from injecting, so we always want a fresh needle because you can give a painless injection or reduce the pain of an injection by always having a fresh, sharp needle to work with, so that helps. Okay, how you doing, okay?
Mm-hmm.
All right, anything starting at all?
Maybe a little numbness.
Numbness starting? Where do you feel the numbness? Can you outline it with your finger? Ear starting to go? Okay, that's it. So you see, as she's saying, her ear is starting to feel a little tingly. That's the block spreading out. The greater auricular nerve carries sensory innervation to the ear. Auricle is ear. And with it are the sympathetic nerves that come with it. The sensation of numbness just tells me I'm in the right area and we got a good block coming on. And over the next 5 to 10 minutes, hopefully she'll start to feel certain other symptoms start to drop. And as we add the other blocks, we're going to just surround this thing like we did yesterday. All right, you want to go ahead and do the right side now too? Okay, so now we're going to do the right side. We do both sides because we're surrounding the sympathetics. There's the left side set of superficial cervical plexus and our right side as well. So we're going to knock these nerves out in conjunction. Do you feel anything changing on the left side, discomfort-wise, pain-wise?
I feel a little less pain.
Where's it going down, you feel?
Jaw.
Okay, what part of your jaw? Back here? Side of your head? Coming down there?
Mm-hmm.
Good. That was hurting you before?
Yeah.
Okay, good. Excellent. So the block's starting to come on. This is not numbing nerves. This is blocking the sympathetic innervation that's causing the pain, the spasm, the swelling that she endures, these different types of skin alterations that they have, and hair falling out that she's experienced and such. We're trying to get all these things to tamp down by quieting the sympathetics down and going after the triggers, which are, again, might be the jaw joint, might be her neck, or some chemical insult. All of those things are going to be analyzed over the next couple of days. All right, so we're going to go to the right side now. It's the same thing, just disinfect. And you can feel this muscle's pretty tight. And I'm not looking to really do anything to the muscle, I'm just can feel that she's very taut, and that's really the sympathetics. When these get blocked, these muscles tend to loosen up too. Okay, so we're going to do the same thing now on this side. So you push against my hand a little bit. Okay, here we go. Okay?
Mm-hmm.
No pressure. All right?
Mm-hmm.
Pinching a little bit?
Mm-mm.
Not as bad as yesterday?
No.
Good. It's interesting, right?
Mm-hmm.
You're doing great. I'm just going to finish this off coming up front. Sorry. Little pusher again. All right?
Mm-hmm.
Done. Let me just wipe it down. Turn back. Okay, so yesterday that was pretty painful when we did it, remember? Was it as painful today?
No.
So what's interesting is, see, we're getting some little light tamping, it's little baby steps. When Jasmine has been ill with this disease for what, 10 years has it been?
11.
11, sorry. Well, who's counting, right? It's a horrible, horrible, painful disease where pain gets the headline because it's the most horrific pain you can have against any disease. That's documented. But there's other symptoms. There's muscle spasming, there's swelling, there's the pressure and sensation of swelling that people get in the front of the head, over the sinuses, in their ears, where fluid can come out, or it feels like there's fluid. And in Jasmine's case, she had spasming right down her back, and yesterday these blocks really gave her relief really to mid-back, and that's wonderful. So we're going to see if we can match that, and it's interesting again that she didn't really have as much pain on the injection. That's hyperesthesia, and we brought that down a little bit already from just one set of injections. Also yesterday she had a tremendous quivering of her facial muscles, and we're going to see if that comes forth again today, or it comes out, or if it stays down, because those are all signs of little baby steps of getting this thing under control. Okay? Doing all right?
Yeah.
Does that left side feel like it's getting more?
Mm-hmm.
Getting any more relief on the left side? Anything different?
Down here, not up here.
Right, well, that's gonna go right. We're gonna be blocking the occipitals. There's two. There's one of the branches of the superficial cervical plexus that's called the lesser occipital nerve. We're gonna block that, and then we'll block the greater occipital, and that really knocks out anything coming off of the C2 cervical spine right at the back of the head. And when we surround all those things, it's just amazing the trickle down to the shoulders, the hands, fingers, and then mid-back and such. So we'll see. All right, so let you rest. Let this one starting at all, anything?
Numb on my ear.
Pardon me?
My ear's numb.
On the right side now?
Yeah.
Catching up, good. Okay, very good. Again, as you get the signs of sensory numbness, that tells me I got a good sympathetic block. The sympathetic nerves need time to be told to go take a little rest. It's like we're giving them a timeout. Then the goal is, as we can quiet the system down, hopefully they stay down, and then as we also discover if there's any mechanical triggers and or chemical triggers, which is coming up with MRI and some chemical analysis we're doing. Right, can we go do the occipitals? You want to hit those? Okay, so to do the occipitals, I'm going to sit her up, because we're going to go to the back of the head. I'm going to take this cushion out so I have a little bit of room. Okay, now, yesterday, she has some very, very hot points. There are notches in the back of the head. One is the lesser occipital notch, then there's a greater occipital notch. I'm going to inject right into them. So is this a little tender right here?
Yeah.
Today? Okay, that's why I'm going to go there now, okay?
Yeah.
All right. So first, we always want to wipe it down with an alcohol wipe first. Okay. Okay, so let's find it again, that hot spot.
Right there.
Right there?
Yeah.
That's it?
Mm-hmm.
Okay, so you hold your head still now, okay? Just perfect right there. So it stings a little bit when I go in with this, but she's gonna get relief. It's not about relief to the area of injection, it's about relief to all the sympathetic innervation that this is supplying. Here we go. Right there, right?
Mm-hmm.
Okay. Okay, a little pressure. All right?
Yes.
Okay, doing well. Okay, so that's about a half a cartridge into the lesser occipital nerve. This is a long-acting anesthetic. I'm just going to mush it, just flattening it out a little bit. And I'm going to come over to the greater occipital. Is that tender right there?
Yeah.
Right there, right?
Mm-hmm.
Okay, so now I'm going to inject this one. This is the greater occipital. Right there?
Yes.
Okay. Here we go. Pressure first. Hurting a little bit?
Yeah.
Okay, a couple of seconds, it'll go away. Better?
Yeah.
Okay, hold on. Okay, rub it in a little bit. Okay, now let me just wipe it down a little bit. So that's the greater and lesser occipital nerve blocks to the right side. We'll do the same thing on the left, and then that's the injections. 2 greater auriculars, and then 2 lesser occipitals, 2 greater occipitals. And what we've done is surround her face and her neck with sympathetic nerve blocks, and then there is literally this trickle down, which I'll then let Jasmine tell you over the next 5 to 10 minutes to see what kind of relief she starts to get. Okay? Anything else coming on better now? Starting to kick in a little bit more? Relief-wise?
Yeah. My pain just it's lower.
Everything's coming down?
Yeah.
Where do you feel the relief?
My head, like my face, my jaw,
Okay, good.
my eyes.
Your eyes are feeling better too?
Yes.
Good, excellent. This is all sympathetic, maintained pain, swelling, spasm, name it. The more things these blocks reach, that's the diagnosis. These are diagnostic / therapeutic nerve blocks. When she gets relief, that's a diagnosis. It tells me what's going on. That's why we do them. It's also therapeutic because she's getting relief. She's had 11 years of this horrible pain through no fault of her own. I don't know a CRPS patient yet that has CRPS through anything that they did to themselves. Rather, they incurred injury, traumas, and unfortunately developed CRPS. But we have a way of tamping down symptoms, especially when they're dominant to the head and upper torso. All right, so I'm just going to switch this out. You all right?
Yeah.
Okay.
I just feel like relaxed.
You feel starting to get a little relaxation going? See, that's interesting because as you tone down the sympathetics, that's exactly what happens. You get this, patients get this relaxation feeling, almost get a little sleepy because the sympathetics are being tamped down. And that's what you want to see. These are all signs of a good block and all good signs that we can control this. The question is, can I get it to sustain it beyond the duration of the anesthetic? Considering this is only the second time she's having this, and yesterday was the first with the relief we got, time will tell. But we got the blocks to help her get comfortable, and then we're looking to sustain it. But already today, what we're seeing is that these injections were not as bad here. And the other thing, yesterday she had terrible quivering of her muscles in her head, neck, and face. Almost looked like she was shivering, but it was just the dystonia of the muscles. We don't see that today. I don't feel it at all. Those are baby steps of improvement. Would you agree?
Yes.
Because you're not getting, okay, so we're making headway. What happens to this set of blocks to duration, we'll tell you tomorrow, because we're documenting this every day. Okay? So we've got one more set to go. All right, so we're going to come over to this side. Let's see. So first, let me see if I can find the hot spot here.
Right there.
Right there?
Yeah.
Okay, that's your lesser occipital. That's one of the branches of the superficial cervical plexus loaded with sympathetic nerves, non-myelinated there. This is what gives you CRPS patients this misery. So, and it's still a bit of a hot spot right here now. We've only done the one injection, and she gets this tremendous relief. That's the good news. As we can get the systems to calm down, hopefully all of these symptoms just for the injections goes down. Well, today is just remarkably different compared to yesterday when we did these injections for the first time. So that's it right here?
Mm-hmm.
Okay, sorry. Okay. Okay, let's go. Now, the other one's right in here about?
Yeah.
Let me get this one first, okay?
That one
right there?
Yeah.
Okay, let me just get your hair out of the way. Good, got it. Okay, coming in. Sorry. So I'm injecting right over the lesser occipital notch that's up here. Nerve sits right in there. You okay?
Yes.
Just spreading it out a little bit. Okay, that's half there. Just going to move it around a little bit. Okay, and one more to go. Is that about right there?
Yeah.
Okay, that's the greater occipital. We'll get this one, and then that's going to be it. Then we're going to sit and wait and see what kind of relief we get, okay? Right there?
Yes.
Okay. Here we go. Sorry, a little painful. Hang in there, a couple of seconds and be gone, okay? Better?
Yeah.
Okay, I'm out. Okay, let me just disinfect that, and we're gonna sit. Good. You all right?
Yes.
I'll put the cushion back for you so you can rest your head. Go ahead, head back. Oh, it's so chill. Okay, I'm just gonna sit you back for a second. More comfortable position. Good?
Yeah.
All right. Let me see what your face looks like. You feel like your face is less taut, less tight
Yeah.
compared to before?
Yeah.
And again, yesterday, I just want to see if you're showing any signs. Yesterday, with these blocks going in, as the blocks take effect, I think you just get this aberrant firing in her. If I didn't know better, she looked like she was shivering, freezing cold because her face, jaws, everything was just quivering. It went away after about 10, 15 minutes as the blocks finished taking effect, but we don't see that today. And some of these injection sites were not nearly as hot. The last one was, you saw it's a little uncomfortable. But the end point is how well does it work? And now we're going to sit and wait, and I'll let Jasmine tell you the relief she's getting over time. It's, in about 10-15 minutes of total time, she's going to slowly see this kind of relief coming on. Is that correct?
Mm-hmm.
Okay, anything else getting easier for you?
My pain was like an 8 before we did it. It's a 4 right now.
So pain dropped from an 8 before the shots to a 4 that it's at now. And what's neat is that's not the end point. This is, as the sympathetics tamp down, there's an ongoing effect of continuing to bring things down, and hopefully in conjunction with the medications, the ibuprofen. Ibuprofen is good. That's over-the-counter Advil. It crosses blood-brain barriers. It's the only non-prescription NSAID that does that. The Lyrica, she's on a very low dose. She's on 25 milligrams twice a day. That's about all you need. If I wanted to, I could up it maybe one more dose, but that's it. You don't need to be on these ridiculous high amounts of these medicines, and you don't have to be on all kinds of medicines to get this under control. The mainstay attack on this disease is these nerve blocks first, and see what kind of relief you get, see where and what kind of sustainability I can get from them as well. Okay, so I'm also curious to see if your hands have changed a little bit. Let me see the other one. So your hands were actually cold earlier. You feel a little not as cold?
Yeah.
Feel a difference?
Yeah.
So yesterday her hands stayed cold, and actually I felt like another hour or so it took, or 2 hours almost, before it really warmed up. It's starting to a little bit better now. What's happening with these blocks, besides pain, CRPS is a vasoconstrictive event. Blood vessels constrict. And when you block them, they open up. And when they open up, that lets blood flow come back in. So when you get blood flow back in, you might start to see certain areas turn red. Her ear starts to get a little bit red. That's okay. That means there's blood flow coming in where it was constricted, and it evens itself out over time. But to her hands were ice cold yesterday, and coming in this morning, and they feel like they're not as cold. You feel it?
Yeah.
So we just let it work. We're getting a better effect today than we got yesterday. Yesterday was the first one. This is just the second one. We're getting more things happening to her that are helping. Okay, any other relief of symptoms?
Yeah.
What else?
My whole head and my shoulders.
Better?
Better.
What about range of motion? Your neck turn better?
Yeah.
A little better?
Yeah.
Okay, now the other, she had terrible pain when she would move her shoulders. Now, go slow, because if you go too quick and the blocks haven't gotten to it yet or getting to it, you could get a shot of pain. But you remember you said
Yeah.
let's see, go slow, slow, easy. Well, that's a crack. I can't help it, the bones crack. Okay, but that didn't hurt until you got better?
Yeah.
Range of motion, both arms, or just the one that was so bad? Better?
Yeah.
Okay, so what's this telling us? All this pain and restricted movement is born of sympathetic dysfunction. CRPS patients suffer terribly when they don't have to, because it's not just pain, it's spasming, it's inflammation. The sympathetics govern all your immune system function or glandular function. It governs your blood pressure, pulse, and respiration. I'm sure all of you who have CRPS have experienced a rapid heartbeat, a sudden jump in your blood pressure, increase in panting and breathing. It's just the sympathetics are saying, do this for no reason. And unfortunately, it can create some panic, and people are worried, and that's when you start jumping to doctors and emergency rooms. They don't find anything wrong because it's the CRPS. And the more heterogeneous the symptoms, the more display of variability of your symptoms, the more you got to think it's coming from the CRPS, from sympathetic dysregulation. And therefore, first line of defense is peripheral nerve block for me. I can do these every day on her without issue. She might get a little sore around the site of injection. I'll just vary the location a little bit, but in essence, I'm going into those nerves. And it's interesting, today we're seeing a more better effect than we got yesterday, with yesterday being the first time again. And we're seeing her hands are warming up more so than yesterday, earlier too. Injection sites were not as painful, except for I know the one was still a little hot. That's okay, she's got things going on that still have to be addressed, but you're getting good relief.
Mm-hmm.
Feel like you're a little sleepy?
Yeah.
Tired?
Yeah.
That's the calm down. When the sympathetics is that flight and fight, and when you block them, they just relax. And what's coming up next for Jasmine is to go into my room that has that big physical therapy chair, and it just gives you a head to toe massage with compression and vibration, and it further helps everything to relax. Also, once these muscles relax and these blood vessels open, now you want to do massage, because massage creates better circulation, and it gets all the chemicals that are built up in the muscles and in the tissues that you don't want there. So that's why massage goes hand in hand with block. With this massage chair, I let patients just go in there and spend half hour or longer, whatever they want, to sit and let that chair work for them. Okay? Doing pretty good?
Yeah.
Want to make any other comments?
My pain is gone. And my hands, and they're pinking up.
Yeah, it's interesting. Her fingers were white. Yeah, this is definitely warming up now. You see? Yeah, both. Her hands were more white, and they're starting to pink up. That's just return of circulation. CRPS is a vasoconstrictive event. It pulls blood deep, and that's why you can have problems if you don't do something about it. It's early diagnosis, early treatment. Good?
Yeah.
All right, so we'll be back tomorrow, and we're going to do this again, and we'll talk about how well these blocks held for Jasmine and how we're doing with her treatment over the next couple of days.